Thank you, Cheryl, for a wonderful introduction to the Eczema Association of Australasia and giving me and Dr. Sebaratnam an opportunity to speak today, and also in particular to your members. And of course, the College of Dermatologists for giving us the opportunity to be part of this exciting webinar today. So just to introduce myself, I'm a practicing dermatologist here in Sydney with working in private practice as well as my public work at St Vincent's Hospital. I am involved in a number of research trials as well as overseeing trials conducted at the Skin Hospital, as well as basic research at Centenary Institute. So today I thought as a panel we would actually discuss some of the exciting insights in terms of how eczema occurs and some of the current treatments and how new treatments fit into this therapeutic landscape. I echo Cheryl's comments about the costs of living with eczema, and indeed it's a huge burden both emotionally and financially for eczema patients with this condition. And we as dermatologists need to be mindful of this in terms of tailoring a treatment plan that fits in with what certainly the level of disease and how we can assist them the best way that we can. And certainly we'll finish off by discussing tips for eczema patients and when to seek help. So I might invite Cheryl and Dr. Sebaratnam to join me in terms of discussing new insights. And I might just kick off by talking about our recent college meeting in Adelaide, whereby a number of new treatments as well as new insights into how eczema arises. Eczema was always thought to be an outside-in disease, whereby it's an issue of the barrier and issues with, for example, filagra mutation. However, as we understand eczema more, we understand very much the immunological processes involved. And with this, from this understanding, we can actually develop newer and more targeted therapies. Next slide, please. Just before I move on, Cheryl, did you want to comment, or Dr. Sebaratnam, did you want to comment about that?
I just would like to comment that I think you're right. It's great that we've got some new insights on how eczema actually affects patients. And we need to be mindful of the fact that even the cost can be quite stressful for many patients. So it would really be good to let patients know what's available. I mean, what's sometimes available at their local big hospital that they may not be aware of. There is some help available out there, it's just accessing it. But as I said earlier, we'd like to work with some more government bodies to actually put some assistance in place. For example, if you're a mum that's got 3 kids and one of your children needs wet wrapping on a daily basis, maybe a nurse to visit for 3 hours every week just to help with that process. And that really helps the stress that the mother's experiencing in caring for a child with severe eczema. So these are the sort of things we need to look towards, not only new treatments, which it's wonderful there are some new treatments available at the moment.
Cheryl, that's a great comment, because yes, as much as we as dermatologists, we get excited about these novel treatments coming onto the PBS, pharmaceutical benefits scheme, either in the form of an injection or a tablet. The current treatments to date do play a role with relation to eczema management. I mean, just very much emphasize that general skincare measures is critical, and for these patients, short cool showers, lots of moisturizer, avoidance of various irritants, and we can cover those in the tips for eczema patients. But there is still a role for topical corticosteroids in the appropriate patient, and particularly if there's superinfection, the use of oral antibiotics where necessary, because we do know, for example, the microbiome does play an important role in eczema flares, for example, Staphylococcus aureus, and thereby treating this. And I know Dr. Sebaratnam will cover whether the role of bleach baths may be useful in these patients, whether or not that could be a potential solution to reduce eczema flares. On to what's on the horizon. Dr. Sebaratnam, in your capacity as consultant dermatologist at Liverpool, I know they do a lot of novel therapies in eczema. Have you had a number of patients put on some of these newer therapies?
And the results are good. I mean, as you said, you know, they're for the most severe cases, and most people with eczema can be managed very well.
And that's right. I feel that and access to these medications, for which two are currently come to mind, one as an injection and one's a tablet, listed on the PBS, they are a real godsend for patients. Access to them is limited to a severity score, a certain criteria that needs to be factored in order for them to access these highly specialized medicines. That being said, though, part of an opportunity to survey how other dermatologists manage eczema in their respective countries, and more patient-reported outcomes. So how a patient feels about their skin is increasingly becoming important in the decision-making process with relation to when a patient actually gets started on a medication. So I think for patients, it's really important to watch this space, because I think as dermatologists, we want to involve our patients more in terms of how they feel about their skin, the emotional impact, their effective quality of life. These are all important measures of deterioration, and also important measures of success when placing patients on therapies. I think that's all I wanted to discuss on what's on the horizon. There's certainly a lot more medicines that are currently being trialed and quite successfully, both here in Australia and overseas. So a number of targeted therapies that come in the form of injections, but also a number of creams as well. So it doesn't all have to be these super fancy tablets and injections. There are a number of creams that, therapeutic creams that allow us to reduce the amount of reliance on topical corticosteroids. But that being said, still a cornerstone in terms of the therapeutic armamentarium in dermatology. Cheryl, you touched on the cost of living with eczema, and you made a comment which I found very interesting. You said that you can't die from eczema. Well, you certainly can die from eczema. There has been cases where, you know, particularly young children, young infants whose eczema has not been managed well, they run into problems like failure to thrive, and Dr. Sebaratnam can talk to his experience as a pediatric dermatologist. I think this is a terrible impact on young children. And I often tell my patients that, you know, instead of growing and thriving and putting on weight, you know, these children are often spending all their energy and their nutrition on repairing their skin, and thereby they're not actually meeting those certain weight and height quartiles and milestones, because they're spending all their energy actually repairing their skin. So this is not only has profound emotional, financial, but also physical impact on these patients. Deshan, did you have any comments about that?
No, I totally agree with everything you said.
How about you, Cheryl?
Can I just add to that? Yeah, you're absolutely right. There are some cases, but they're not as predominant as other diseases. And this is the perception out there that, you know, there are a lot of other diseases, but we get a lot more assistance with them. But a lot of them can manage with what's already available. It's only on the severe end of the scale that we see this. And we want to help everybody with eczema, not just concentrate on those that are really severe. I feel as though sometimes they get more assistance than just the ones that have quite bad flares from time to time, but aren't actually eligible for some of the newer treatments. And they seem to get overlooked quite a lot. We tend to concentrate on the ones with allergies and really severe eczema. And you're right, there's no one thing that you can't die from, but it's more unusual with eczema as compared to something like diabetes or cancer, for example. And it's good that we are finding some new treatments to really help those poor kids. What we do find is the comorbidities they often develop from having eczema quite severely that can carry on into their life. And there's a lot of research about that now, heart problems and all sorts of things that can shorten their lifespan. So you are absolutely correct.
No, I think that lends very well to the next topic that I'd like to discuss, which is tips for eczema patients. I think both Dr. Sebaratnam and myself have spoken to various audiences, be it training dermatologists, general practitioners, pharmacists, and that education piece about managing mild to moderate eczema is just so important, because I would have to say that's the majority of most patients. Yes, there is a category of severe patients that do require our assistance as well, but for the most part, a lot of atopic eczema can be managed with topical measures, and thereby that emphasizing that educational piece, not just for patients, which is what we're here to discuss today, but also for healthcare providers and any of those people involved in eczema education. You know, nurses as well are very important and form part of the network of healthcare professionals involved in eczema care. So moving on to general tips for eczema patients, I do like to, my eczema consultations can be quite long, and I spend the majority of the first consultation addressing the flare. And all I want them to concentrate on is actually reducing that flare and applying the appropriate amount of moisturizer as well as topical steroids, and then treating any concomitant infection at that point in time. Once that I've actually achieved clearance or improvement from their eczema, I then talked to them about long-term management. How do they prevent eczema from coming back? And that's, for example, through the use of, we sometimes use weekend therapy for topical steroids for a period of time. We sometimes also use, of course, various emollients, which some have various ingredients that help to repair the barriers that are affected through eczema, and of course, short cool showers and soap avoidance. And these are very much the cornerstone of managing one's skin if they are prone to eczema. Deshaun?
Yeah.
Your pearls of wisdom? No,
I mean, I'm covering a little bit in my talk, but nope, agree with everything you said. Like you said, soap-free showers, regular moisturizers.
Yeah, and I think the important tip is actually, and I think you will emphasize this in your talk, is, you know, topical corticosteroids do play a role and have a role in eczema, so don't be afraid to use them. And as dermatologists, it's our role to teach patients how to use these effectively and safely. So Michaela, I think we'll move on to the last topic of when to seek help. So I think this is an important topic to cover. I think when there is infection involved, and I know Dr. Sebaratnam will show you some photos later in his talk, but particularly look out for signs of infection, signs of where the human body is telling you that something's wrong, having a fever, fluctuations in blood pressure, particularly for infants, not feeding well, not putting on weight. These are all signs whereby you may need to seek professional help with relation to eczema. Deshaun?
No. I totally agree. So your first port of call should be your GP, but then if in doubt, see a dermatologist.
Fantastic. Cheryl, did you have any pearls of wisdom or tips that you'd like to tell our audience?
They're great tips, and we always advise people to seek medical help. If there's any sign they think they may have an infection or their child might have an infection. But, you know, for the general population who can often just experience a mild flare at different times of the year, we do put up tips on our website. Every season we have our autumn tips, our winter tips, and it just gives you a bit of an idea of how to change your emollients, what products to use. It can be really helpful, things that you can do around the home to prevent your skin drying out as much. And even little things such as in winter, we all stop drinking as much water, you know, things that really help your skin barrier just to keep as, you know, as well as it can be. And then that helps your eczema flare. So I think, you know, seek help as soon as you need it, and definitely consult your doctor or your dermatologist if, you know, you're finding it a bit too hard to manage yourself.